Hello and welcome to another episode of Healthy Perspectives. My name is Vernon Solomon. You know, on this show we continue to talk about some of the issues and health issues that plague us here in Antigua and Barbuda as well as the region. And one of those is diabetes. This morning, or this evening I should say, we have a special guest with us, Dr. Bauer Sumpio from Yale University. He's professor as well as vascular surgeon there, who has a special outlook, if we would, on the issues that are associated with our diabetic patients. So I'll start with you, Dr. Sumpio, and please forgive me if I mispronounce it. Sumpio?
Sumpio.
Sumpio, perfect.
Yes.
In your expertise, we talk about prevention all the time with regards to diabetes. What are some of the challenges that you see and that your patients are faced with to overcome the issues associated with the diabetic patient?
Well, Vernon, as we talked about a little before this filming, diabetes unfortunately has many problems associated with it. Besides the eye problems, kidney problems, cardiovascular problems, unfortunately, there's a lot of problems associated with the circulation to the feet. So my particular area of interest is the diabetic leg. And we know that patients with diabetes, especially if you've had diabetes for 10 years or longer, have an extremely high risk for amputation.
Okay.
This is about 10 to 15 times greater than somebody who doesn't have diabetes. And the problem is that you can't put your finger on one particular aspect that leads to the risk of getting an amputation. So we have patients who appear with us who might have a minor crack in the skin. Maybe they got some new shoes. Maybe they get bit by a mosquito and they scratch it and then it doesn't heal. That frequently leads them to us to seek some attention.
So literally something as simple as a mosquito bite left untreated or irritated can be a major complication for a diabetic patient.
Absolutely. The number one cause of a diabetic foot ulcer is neuropathy. The patients develop lack of sensation to the foot. So they may have a wound. You and I will feel this wound, but the patient who has diabetes with sensory neuropathy may not even know what's going on. Unfortunately, one of the biggest problems we have, even in the United States, is that when the patient comes to see their primary care doctor, unfortunately, they don't even ask them to take their shoes off. And sometimes I'll have a patient, they says, it smells funny here. And they say they don't know what's going on, and they take off their shoes, and they see that they have an ulcer because they don't feel it. So protecting that foot for a patient with diabetes is very important. And I think for the healthcare givers, one of the important messages that we have is that you must inspect the foot of your patients. And not only that, if you could take it one step further, can you examine sensation to the foot? Because once the patient knows that their sensation is impaired, then they perhaps will be more careful with it and also will be more diligent at seeking earlier care.
Do you think that part of the diagnosis or when a patient receives the diagnosis, you're a diabetic, many times we then focus on nutrition and lifestyle changes that they may then need to make. Is it to say that more emphasis needs to be placed also on educating the patient about their limbs and how to protect their limbs? And is enough of that education done?
Well, I think education is paramount. And it's education both of the patient as well as the physician.
Okay.
But from a patient standpoint, they do need to be educated. They need to be educated with respect to foot care. And the best way to do that is with your shoes. Unfortunately, in the Caribbean, one of the biggest causes, the greatest cause of getting a wound in the foot is because of improper footwear. It's hot here.
Yes.
And so it's inconvenient to really wear shoes. And most patients that I've seen, even in my brief time to the Caribbean, a lot of them wear slippers or sandals, and they wear them down. And you can see that they can sometimes get a wound in the foot. So yes, Vernon, you're absolutely right. Patient education is paramount. The patient and their family, their support, really need to keep an eye out for those feet. Protective footwear is important. And I would also like to mention nails.
Okay.
Trimming the nails, right? It's very important, especially if the patient is elderly, perhaps their eyesight is poor. They can't cut the nails by themselves because if they don't feel, they might be cutting into themselves or cutting too deeply. So care of the toenails are very important. So if you have family members there that are helping take care of one of their loved ones, perhaps one of the most generous gifts they can is perhaps helping that individual trim their toenails.
When you are educating your patients in your practice, is there a systematic approach that you go through to ensure that all of these elements are covered? And if so, what is that approach?
Well, Vernon, this is very important, and this really is what we try to do when we interact with the healthcare givers here. Mm-hmm. As I mentioned to you, sensation is very important.
Right.
We have a little tool. It's called a monofilament, and essentially it's a piece of fishing line.
Okay.
And normally, you and I may feel this fishing line before it bends.
Right.
It's thin enough. But a patient with diabetes who has this neuropathy, a fishing wire that's even 10 times as big, 10 gauges bigger than what we normally feel, they still don't feel it. It's very simple. It costs pennies to help, but it establishes sensation. The second aspect is feeling for pulses in the feet. Unfortunately, this is my area of specialty, is the blood supply to the foot. Patients with diabetes have poor blood supply to the feet. If you can't correct that, unfortunately, no matter what we do, you may end up with an amputation.
Okay.
The third thing is care of the wound and infection. Infection in patients with diabetes is a tremendous, it's more difficult to control than in patients without diabetes because the immune response in patients with diabetes is impaired. So again, having the proper wound care, perhaps antibiotics, is very important.
Do you see these complications, the ulcerations, the infections, in one gender versus another? Is it seen more in males than females? And I smile because we do a Men's Health Day here at AUA, and many times we find that men don't go to their healthcare providers as much as the females or their partners may do. Do you see the infections and the ulcers more in men than you do in women?
Well, it's an interesting point that you bring up, Vernon. One of the anecdotes I had from one of our patients here, because his wife came with him, and I tried to get a history of what happened to him, and his wife immediately blurted out, "Hardness of men." And I said, "What does hardness of men mean?" And it's exactly what you've talked about. He says, "Well, he did not want to come in. He did not want to be evaluated." So you're absolutely right. Sometimes there is this male reluctance to seek medical care. But interesting, in a talk that I had, because I prepared on Wednesday, it turns out that the population, the percentage of women on the island, about 35% have diabetes compared to men, which was only about 12%.
Okay.
And that's quite surprising,
yes,
that the women actually have more diabetes. Perhaps it's because they care for themselves better, that they don't have the manifestations, but women on the island tend to have more diabetes than the men.
Okay. Which leads me to, we're going to take a quick break and come right back, but I'd like to find out what are some of the results of leaving these ulcers and not having the proper care that one needs. If you would speak to that in just a moment. Stay with us, please. We'll be right back.
Did you know that asthma symptoms are typically caused by a number of irritants? Irritants include pollution, smoke, animal dander, mold, dust mites, cockroaches and cockroach droppings, very humid or dry air, and even very cold air. Problems such as acid reflux, obesity, anxiety, and excessive exercise have also been known to trigger asthma symptoms. This message has been brought to you by the AUA Asthma League. This spring, The AUA Asthma League's Managing Your Asthma presentation will be held at Mount St. John's Medical Center on March 26, 2014 from 6 p.m. to 8 p.m. There is no admission fee and the presentation is open to the entire community. Please join us to learn more about asthma, a disease that is very prevalent in Antigua.
Hi and welcome back. If you're just joining us, we have with us still Dr. Bauer Sumpio from Yale University. And we were just talking about what some of the complications are associated with diabetes, as well as what the effects are from having ulcers and so left untreated and not having proper care or doing proper care of one's foot. So what's the ultimate outcome if the patient, that diabetic patient, does not follow the regimen and doesn't care for their feet or their limbs?
Well, unfortunately, Vernon, they're going to lose a part of them. It can be a minor amputation, which means they lose their toe or perhaps their forefoot. But ultimately, I think many of them, the majority, I would say 60 to 70% of patients who require, who will lose their limb will have what we call a below-the-knee amputation. That is, the knee will remain, but unfortunately we will have to do an operation that cuts the leg at the mid-calf region. A minor number, perhaps about 15%, may require what we call an above-knee amputation. And that probably is due to the circulation not being adequate, and that becomes much harder for them.
Is that then just because there's no, I won't say cure, but treatment? They've had an ulcer, the wound has been treated, it can't be saved?
Well, as I mentioned, to treat a wound, for a wound to heal, there are two key components that need to be addressed. If the patient has adequate blood supply to the foot, that means that the circulation is intact. And you can sometimes assess this on yourself if you can feel your pulse in your feet. Absence of a pulse doesn't mean it's abnormal, but certainly if you can feel the pulse, that's a good sign.
Okay.
So that's the first step. If you don't have that, you're going to end up losing. The wound will not heal without blood flow. Unfortunately, there are a number of patients who have adequate blood flow, which then means that in order for that wound to heal, you have to treat the infection in that foot. And that means proper care to the foot, cleansing the wound as dictated by your family doctor, putting clean bandages on it, and giving the wound time to heal. As we mentioned, when you have diabetes, unfortunately, it takes a much longer time for wounds to heal, and that's because your immune process is impaired. All right, so you just need to give it time. Whereas it might heal in 5 days for me, it might take 2 or 3 weeks for it to heal. And so you have to be patient.
What do you see the outcome of your patients? What is the outcome, rather, of your patients after they've had this amputation? Do they go on to lead a fairly productive life?
Absolutely. What we always say is just because you lose your leg doesn't mean you've lost your life. It doesn't mean you have lost the ability to ambulate. And we say that because nowadays we have the technology to provide you with prosthetics. These are artificial legs that enable you to walk. If you've lost part of your foot, that's very easy. We have fillers. You may not even need anything. You can walk. But if you lose your leg at the calf level, but your knee is preserved, that we have good prosthetics because you still have your knee, and we can get you to walk properly with it. If you lose it above the knee, all is not lost, but it's more difficult. And that is the amount of energy that's needed to walk if you have an above-knee amputation. It's quite high. You need about 60 to 70% more energy than you would if you didn't have an amputation, compared to a below-knee amputee who perhaps needs about 20% more energy expenditure.
You mentioned prosthetics, but I have to bring up the fact that fortunately we live in the Caribbean, and many of the same services, equipment, techniques, even treatments may not always be as readily available here in the Caribbean as they may be in North America. how does that benefit me as a patient here in Antigua, having, whether it be a below the knee or above the knee amputation, how does that help me as far as a treatment option?
Well, I think you brought up the sad fact, right? The reality of the situation is that it takes resources to have an artificial leg. First, you need the components. The foot itself will perhaps cost about $3,000 to $5,000 US, because these are feet that actually are almost spring-loaded. It helps you walk. They're not wooden feet. The componentry, the assembly of this, the creation of the socket for your stump, this takes money. In the United States, this will cost you anywhere, 15 US to 20 US dollars, $1,000 to have this. And we know that this is not available on the island, right, unfortunately. And so many of the more able-bodied young men who've lost their leg, not for any reason, not because of their fault, but because of the disease they have or perhaps from trauma, they're out of society. So this is the initiative that we came to the island for. It's something that we started in Grenada and in Barbados, and because Antigua was an island that our contacts felt would be appropriate, we came to Antigua. We arrived here, my team came here last Saturday.
Okay.
And because of the wonderful work of Alfonso Richardson at the Mount St. John's Medical Center, Leslie Walwyn, the administration there, and as well as the Minister of Health, who was very involved with this, we were able to identify out of numerous candidates 10 individuals who were felt to be good candidates for prosthetics. So my team and I came down. We had 2 prosthetists, myself, another helper come down on Saturday. On Sunday morning, we started bright and early, and patients showed up. We told them to show up at 8 o'clock. I know that some of them were there at 6:30 in the morning because they wanted to be first in line for this. We were able to, at the end of the day, on Wednesday, we were able to have 10 individuals walk because of the prosthetic components.
And some of these people had not walked in how long?
Some of these people had not walked. There was one individual who had not walked for 10 years. We had 2 individuals who were 5 years who had not walked. And for them, for me, the pleasure was seeing them stand for the first time, because they forgot what it was like to stand on their 2 feet, let alone to start walking. And they were so excited, and I think that is what really brings, the smile to your face and to your heart.
And that's the encouraging part, because early on you mentioned it's not the end of the world, but the fact is now you see that on somebody's face. They've come to life again. We're going to take another quick break, but what I'd like to do when we come back, you said this is an initiative, so I'm hoping this is not the last of it, this visit. Stay with us, we'll be right back.
Did you know that asthma is controlled by medications such as steroids that reduce inflammation in the lungs and beta agonists that relax airway muscles? You use the long-acting versions for daily asthma control and short-term versions for any symptoms you might have. When you find yourself using short-term medications more often than usual, your long-term medications may no longer be effective, and it is important for you to see your doctor right away to adjust your medications. This message has been brought to you by the AUA Asthma League. This spring, the AUA Asthma League's Managing Your Asthma presentation will be held at Mount St. John's Medical Center on March 26, 2014 from 6 p.m. to 8 p.m. There is no admission fee, and the presentation is open to the entire community. Please join us to learn more about asthma, a disease that is very prevalent in Antigua.
Hi again, and welcome back. We are still here with Dr. Sumpio from Yale University. And Doc, before the break, you mentioned this initiative between yourself, your team, Mount St. John's. Is this event that just happened this week, you provided prosthetics for a few patients here, is that the end of it?
Well, certainly not. I hope not. This here takes a village to make everybody walk. And we can't do this alone, because we certainly need to make sure that we have buy-in by the hospital, by the Minister of Health, and so forth. Part of what our mission was not just to provide for the prosthetics, but to actually transfer some of the information to healthcare givers here on the island. So working very closely with Alfonso Richardson and his team, he identified 2 other individuals, Justin and Bowen, who work under him, and they were quite eager. And they spent nights with us, because we worked late at night to try to get this done, and they were there. They showed the commitment. And so our plan here is for representatives here who know what we do. We can perhaps liaise with them by Skype or so forth if there are any minor modifications that are left on some of these patients, in the coming months. But more importantly, now they know and are getting many phone calls from patients on the islands. So the plan would be now to create some kind of registry of the patients on the island. We'll have a listing. We'll try to prioritize them. And as I told you, the priority really is not by anything else, but perhaps by the size of their shoe, their weight, which side the amputation is on, because we have to rely on donations for these feet. These are perfectly good feet. They're brand new. But for some reason or the other, they can't be utilized by the manufacturer. So we take it off their hands. So we're quite dependent on that.
This gives so much hope to individuals here, patients here in Antigua and Barbuda that have been amputees for years, and as we mentioned, may have thought, this is what I'm going to have to deal with for the rest of my life. And we at AUA would then extend our hands definitely to say, if there's anything that we can do to assist, we're more than willing to do so just as well to facilitate this. And I say Antigua and Barbuda, I have to ask you this question. We have our Barbudan viewers just as well. Were you able to tap into any patients from Barbuda that may have been suffering from, or that are amputees and or candidates to be fit?
No, we haven't on this visit, and part of it was logistics for the patients to come over. But I think that as this program has now been initiated, and we know it's feasible, and we know that we have the buy-in from both the government as well as the hospital administrators, I think this will help facilitate getting everybody who needs it, an opportunity at least to get a prosthetic.
Is there anything that you feel you need to conclude by letting our viewers know about diabetes, caring for the diabetic foot, the prosthetics, for them to say, okay, a take-home point, a take-home message?
Well, I'll tell the patients with diabetes something that I've heard quite often, and that is the patients who say, we wish we knew how important it was to walk, and we wish that we took better care of our foot beforehand, that we could have probably prevented the loss of our feet. So preventing and taking care of that foot is the most important part that you can do on your behalf.
Thank you very much. I hope you have enjoyed your stay here in Antigua.
Antigua is beautiful, but the people are really very warm, and it's made our stay very pleasant.
Excellent. So you will definitely be back.
We hope we can come back, and if we're invited back, we will definitely come back.
You've been invited. I promise you, you've
been
invited.
Thank you, Vernon. Thank you.
All right, stay with us again. We'll be right back.
You may have heard that asthma symptoms can include shortness of breath, dry coughing, and wheezing. But did you also know that it can present with chest pain, chest tightness, and force the asthmatic to use their shoulder muscles to help them to breathe? This message has been brought to you by the AUA Asthma League. This spring, the AUA Asthma League's Managing Your Asthma presentation will be held at Mount St. John's Medical Center on March 26, 2014 from 6 p.m. to 8 p.m. There is no admission fee, and the presentation is open to the entire community. Please join us to learn more about asthma, a disease that is very prevalent in Antigua.
Dr. Sumpio gave some very sound advice as to what one would need to do in order to take care of the diabetic foot. To support that, there's another program called Step by Step. It's put together by the International Working Group for the Diabetic Foot. There's a video that we'd really like to show you this evening. Please enjoy.
Do you know that in a lifetime, a human being walks about 100,000 miles? That's like walking around the world almost 4 times. Now imagine, halfway through your life, having to do this on one foot, or even on a wheelchair. Hello, I'm Dr. Fitfoot. Do you see now how much your feet support you in your lifetime? Do you know that apart from accidents, maximum foot amputations are done on people with diabetes? The reason is they don't feel pain in their feet, and that's the problem. If you live with diabetes, this video gives you basic tips on foot care so you can lead a healthy, productive life. This video is broadly divided into do's, don'ts, and danger signs. First, the do's. Use a mirror to check your feet daily. Look for cuts, bruises, blisters, color changes, swelling, ingrown toenails, and open sores. Always protect your feet against injury by appropriate footwear. Keep wounds covered with clean dressing. Wash feet daily with soap and water. Take care to wash between the toes. Dry feet carefully, especially between the toes. Keep skin soft by using lotion on the top and bottom of your feet, but not between toes. Preferably, do this at bedtime. Cut toenails straight across and file the sharp edges. Before putting them on, check shoes daily for rough places, any irritating objects, pebbles, nails. Now let's see what you should avoid. The important don'ts. Don't let your feet get dry and cracked. Don't go barefoot, either indoors or outside. Since the diabetic foot does not feel pain, see what can happen until gangrene sets in. Do not use hot water to wash your feet. Don't wear torn or tight shoes, or shoes with rough and uneven seams. Avoid shoes with narrow toe box, sandal with thumb between toes, or footwear that have just straps and no back support. Don't wear tight socks. Do not use corn medicines, blade, knife, or any sharp instruments. Now let me tell you about the danger signs. If you become aware of any of these danger signs, seek help from your doctor immediately. Your foot becomes painful. Your foot becomes noticeably red or has any unusual discoloration. You feel a part or all of your foot is much hotter than usual. There is a discharge of any kind from your feet. Your foot smells bad. Your foot has an open sore or blister. You feel generally unwell with nausea, vomiting, or high temperature. You have unusual difficulty keeping your blood sugar under control. Please follow these guidelines unfailingly. your doctor can only advise. It is your foot. Remember, foot problems will not be painful, but can still be very serious.
Take care of yourselves, and as always, we thank you for spending some time with us and for allowing us to share healthy perspectives with you. Be well, Antigua and Barbuda, and may your perspective always be a healthy one.